You want to make the best decisions possible when choosing medical coverage plans. So we bring in Bill Green, the owner of Green Insurance Agency, and he says he can help you navigate the Medicare changes that you need to be aware of. Welcome back to First Coast Living.
Thank you.
And the big question we'll start with is how much you've helped people over 65 years of age.
Yes. So we're getting more and more people who are working past 65 to carry a spouse, add to retirement, add to Social Security. And when they do that, there's a specific way they need to enroll in Medicare. If they already have Medicare A, then that's the easy part. If they've been contributing to an HSA account, they're not allowed to have Medicare A.
Okay.
So there's two forms they need to fill out. One they fill out, the other one their HR department for their current employer does. We have a pretty good system for getting those forms filled out and sent in. We can even help with your HR getting it filled out. We can make that connection for you.
Very good. And you're telling me this is one of your busiest times of year. And I know you're always busy. You got the clients coming in, so you've seen it all. So
yes,
that helps folks. If they have questions, they can come to you. And let's talk about all the folks relocating to our beautiful First Coast. Well, I don't blame them, but there's been a lot lately. So you have one example of a family that came from Ohio?
Yeah. So we're licensed in about a dozen states. Ohio is one of them. Also, Georgia's so close we kind of have to be there, so we can help folks in Georgia too. This guy's in his 90s. He was recently diagnosed with cancer. He moved here to be with his daughter to help take care of him. And the plan he was on in Ohio doesn't exist here. So when he moved outside of his plan service area, which made it where he had to change plans. He lost his coverage. So by doing that, he was able to enroll a plan that normally he would have had to answer health questions for. So now he did not. So now he's going to be able to get some really good care without having to worry about going through any medical questions or pre-existing conditions.
Very good. That's a definitely good example there. And with all the folks moving here, again, you're seeing a lot of that. So you're ready to go on that front.
Oh yeah.
Other things I'm hearing about, new legislation, in the area, and it's affecting both Medicare and Medicare recipients. Can you talk more about that?
Yes, so the Inflation Reduction Act of 2022 is affecting Medicare beneficiaries in a good way. So what it's done first is going into next year, any vaccine that's billed under their Part D prescription drug plan, they get at a pharmacy, now have to be zero. The big deal with that is shingles. For years, that's been about a $400 to $500 cost for people. Going into next year, that's now zero.
Wow, okay.
Yeah.
A lot of relieved people out there.
Yes, and then also, going into 2025, there will finally be a max amount of pocket on medicine costs at $2,000 for the year.
Okay, and it's not always been that way. That's a big change as well.
Right now, there is no max. I've got people that will spend $5,000 and $10,000 this year on their medicines.
Okay.
Just because of the cost of those medicines.
Okay, so you're full of good news. I like it.
Yeah, absolutely.
Okay, we're all looking in the mail. I'll be checking my mailbox today. So what do we need to look for in our mail as far as these plans go?
So for someone on Medicare, there's two pieces of mail you want to look out for. The first is your plan's annual notice of change. That's the one just letting you know what's changing in the plan. Okay. What they're adding, what costs are changing, if they're taking anything away. And the other is your current Medicare agent should have already reached out to you by now. We got our mail out a while ago. We're already scheduling our appointments for October to do those reviews with people. Okay, and then what should someone do to prepare for this open enrollment? So first is read through the annual notice of change and see if there's any major things that are changing. Most plans are adding things. Some are taking a couple things away, raising copays or lowering copays. See how your plan is going to be affected. And then most importantly after that is reach out to your current agent if you have one. If for some reason you don't have an agent or you can't get a hold of them, feel free to call in the office or visit our website and be happy to schedule a meeting with you for October. Very good. Well, it's always a pleasure having you here on First Coast Living. Thank you. And yeah, good luck with the new baby. Thanks. I know you're a busy family man, but you always have time for the people, and that's what's important. That's what's important. So, of course, we'll have much more on Bill Green Insurance. Just head to our website, firstcoastliving.net.